Hi, this is
Okay.
Dr. Noel Lloyd, and I'm with Dr. Kendall Sweeney, and we're going to talk about the Associate Empowerment Project. Dr. Sweeney is a chiropractor practicing with Dr. Dana Klum. She's an associate in Kirkland, Washington. Good morning, Kendall. How are you?
I'm good. How are you doing, Dr. Lloyd?
I'm doing fine. The reason we're giggling is I just called her Kendall Jenner. And but let's get past
Mhm.
that.
Yeah.
So we're talking about the AEP, which stands for Associate Empowerment Project, and you just finished that not long ago. Tell people, maybe associates or clinic directors who are
Mhm.
watching our video, what is the Associate Empowerment Project?
I think the best way to describe it is like a road for an associate to learn how to grow their practice and support the practice they're in and start seeing more people and learn how to get out there. So it provided a lot of structure. There was weekly meetings, webinars with other associates in the area, and just lots and lots of learning scripting and how to get out and set up events, how to get people in the office, what to do with people once you got them in the office. And it provided just sort of like literally like a roadmap of like, you do this and then this and then this, and you wind up here. So I found it really helpful.
And what I've told people before is that I put together my associate training program that I use to develop 70 plus associates, very, very
Mm.
successful men and women. And we condensed it into 8 weekly 1 hour webinars. And I gave assignments, and then we worked together as a group. One of the things that I think is surprising for some is the power of the group, or what the group actually does
Mhm.
for you. So was the group helpful? And if so, why?
Yes. I mean, for one thing, camaraderie. There are people I've met in the AEP that live in my area that I have now invited to other events, seen at different conferences, which has been really fun. And it's great to be able to talk to someone about the struggles, because the struggles of trying to grow a practice, I think, are pretty universal,
Mm-hmm.
so long as you're working hard.
Yeah.
And then also just, I think, being held accountable. It was a group setting. It was like a group dynamic where it wasn't like we were per se in trouble, but at the same time, it was really important to show up on time and have everything ready that we were supposed to have ready. And
Well, the
it just,
reason you didn't
yeah,
get in trouble is because you showed up on time.
yeah.
So, well, let me talk about that, because that is a component. I tell people at the start that I'm going to push you outside your comfort zone.
Hmm.
So I think your comfort zone kind of wars against your success. Your comfort zone is usually a set of fears. How did I push you specifically outside your comfort zone?
I mean, especially I think with the setting up events and things, it
Right?
was the first couple attempts were, I mean, I did some awkward stuff. They were a little hard and very, defeating. Have to develop a thick skin, because there's all, and what I learned is there's all different kinds of communication, not just with patients, but with people trying to set up these events. And knowing that I had to do a certain amount every week
Right?
meant that I was just out there doing it until it worked out. And that was definitely outside my comfort zone, because sometimes I wanted to just be like, I wanted to stop, but
Right.
I couldn't. So,
So now the objective of pushing you outside your comfort zone isn't because I'm a mean guy and I love to see people
mhm.
suffer. Uh, and uh, but so what happened to you, with you, in your practice, in your heart, in your head, in
Mhm.
your guts? What happened as a result of being pushed out of your comfort zone?
Well, for one thing, in those 8 weeks, there was I think it was probably about 4 or 5 weeks in, I started to actually get some traction, and it was just,
Yeah.
my practice started to grow. So that was pretty amazing. I also became less awkward. I started to memorize the scripts. I felt much more comfortable talking to people. I started to feel like I absolutely can do this. It's just a matter of when, and that, I think, is empowering. I think that's the point. It's the Associate Empowerment Project. And I think that I realized that it's really just a matter of figuring out how to do certain things, which is what the guidelines and the roadmap was for. And then once I understand what those things were, I felt like I can do this. It's just a matter of putting all the pieces in place.
So we snapped all the pieces together. The first thing that we focused on in the AEP was practice vision, philosophy, and goals. And I kept referring back to that. What was the reason there, and what did referring to philosophy, vision, and goals do for you through the process of the AEP?
It did a lot, and that's something I've actually continued to come back to all the time. But when our philosophy is at the foundation of why we're doing what we do. So when I know why it is that I'm trying to grow a practice, and I have my vision clear and I'm focusing on that, it makes all of the sort of the moments of rejection, or those moments where it's a little more uncomfortable, or when I may have a dip, for example, or maybe I do one screening and I have like 7 people sign up, and then for some reason the next week nobody signs up. It makes those moments much more manageable because they're all bigger picture.
Right, you're going for the right reason, and the right reason is to share, and it is to give because of our philosophy. We have a vision of a busy practice, and we need to get new patients. And since you're brand new, there's 2 places you can get new patients. You can get new patients from your own effort, or you can just hang around the clinic. And I think one of the things that happens to young doctors in some associateships is that they're never developed with their marketing skills, and always end up almost disabled, so they can never produce new patients, and they don't know how to market, and they don't know how to get through that particular process. Now, in a very few short weeks, you went from a small practice to how long did it take you to get to your high number, and what was that high number of visits that you produced through new patient marketing?
I got to 71 visits, and
Great.
I think I had 6 new patients that same week.
Great.
I think from when I really started to get traction to when that happened, honestly, it was like 6 or 7 weeks. There was a stretch of time where I was getting 10 plus new visits every week just because of bringing people in, which was kind of amazing. It was like just a train started going.
Yeah. I mean, so there's a combination of momentum, and you get a few wins under your belt, and you're focused on your philosophy and your practice vision, and it's getting clearer and more real. So now tell me, what do you want to be doing in your practice, let's say in the next year? Do you have goals for your specific practice? And how did the AEP help you formulate those goals and give you a perspective on reaching those goals?
I definitely within the next year, I would like to be seeing 200 patient visits a week.
Right.
And that specific goal, a lot of things. It also means I'll be making more money. So I have financial goals in that way.
Right.
And I want to, of course, at that point, be getting a few more referrals, but also I want to get to a point where I'm so busy that I can't spend as much time outside the office.
Right.
So, but as far as the AEP's role in that, I think that prior to the AEP, I thought I had the same, like, I'd love to see 200 plus visits a week. That would be great. But I didn't, where that point was, and like the beginning and then that 200 visits, I didn't really understand how that would work. But all of the combination we talked about, we would do power hours. So even when I wasn't seeing a lot of people, I would cluster book all of my people in an hour or 2.
Right.
And all of those practices gave me I understand I'm completely capable of it. I can see a lot of people. I can help them with a lot of things. And I know how there's like a machine, sort of, I feel like there's just like a new patient machine in a way that I can harness to make that happen.
So let's talk about some of the things that we covered. Let me make a list. We talked from the very start about philosophy, practice, vision, and then also we talked about goals. We went on to do new patients. We've talked about that a bunch, but we also, when we get those new patients and when they come in, what were some of the scripting components that we worked on in the AEP so that you were ready to handle those new patients?
Pre-consultation script, use it all the time.
Right.
Every time. I think that's really great because it sets the stage for what we're doing in that initial visit and why we're doing it and how it works out. And
very powerful.
Yeah. The report of findings script, huge also. I thought, as far as the philosophy, I think that, 99 out of 10 of the people that come into the office are coming in because something hurts, which is very real. But there's more to what we do than just trying to help their pain go away. And I think that the ROF script sort of touches on that, and it sort of it basically is a beginning point for that conversation with people.
Right.
Under care. I think also the 3 phases of care chart that we talk about, being able to reference that and kind of, I often have told people that many people's chiropractic care will end after that relief phase.
Right.
So just being able to utilize all those tools to guide people through the process so they have a different understanding of what we're doing and they're more invested.
So now, and you mentioned this, you feel more powerful. Just briefly, a list of things that you might feel more empowered to do. What would that be?
Oh man, really talk to anyone about what I do, especially talking to other practitioners. So that includes physical therapists, orthopedists, even a handful of neurosurgeons. I've talked to a couple physiatrists. I feel a lot more confident about what I know and how I can help. And and setting up events. Like I actually had the thought the other day, I think I'm starting to get my mind wrapped around marketing, which is a skill I guess I never really considered I needed.
Right.
But I have much more confidence in talking to, going into these wineries, which I was thinking, what does a winery have to do with chiropractic? But it's a really great place. So I feel, and honestly, you run into people every now and then that want to tell you what it is that we do, and they have their own little opinion and it's not right. And sometimes I still get frustrated by that, but I think I'm starting to, it was mentioned in the Too Many New Patients seminar, somebody said something to the effect of like, someone says no and you just kind of go next.
Right.
And so I feel like I've had that. I think that's really helpful as you just keep moving.
So let's talk to the clinic director or associate. Let's speak to the associate who's thinking about participating in the Associate Empowerment Project. What would you say to that person? I don't know if I should do this. It sounds to me like it's a lot of work. It is. It sounds a little bit scary. It might be. What would you say to that person about the AEP?
I would say it's definitely worth it. It is a little bit extra work, but it's a matter of learning how and like learning the way and getting those people in and practicing and being able to practice in a way that you've probably always imagined. You're going to have a support from all the other associates that are in the program, and you're going to have really clear guidelines of what you need to do step by step. So completely worth the effort.
What did your clinic director think? You guys have had conversations about what happened with you, to you, through you, for you in the AEP.
She just thought it was great because it was, she provides a certain amount of guidance, but it was like I had this living handbook in a way through you and the other associates. And so she just watched it happen. And it was just all of a sudden I had all these new patients scheduled and she, I don't know if I'm articulating it right, but she just
You're doing a beautiful job.
Okay. She thought it was really great and was impressed and happy with how quickly I was learning.
In fact, she sent me an email after I asked her, are you happy? And she said, it's so great. And it's nice to have somebody else to support the training that she's giving. You've mentioned to me, and I know this about Dana, that she's a good trainer and she's so sharp and she's generous, with her mentoring. And so she was glad that we supported that. So I believe that every single goal that you have in chiropractic practice, you will get to, because you have demonstrated to me, and this is one other thing that happened in the AEP, is that we give you a stage. We give you the things to say. We write the script, and the script basically is heroic, wonderful associate who's doing successful things. And you really participated and gave yourself to it. And I know why your clinic director is impressed with you. And I know why you did so well in the AEP. So my forecast, my prophecy is that you're going to have an absolutely wonderful chiropractic practice life, and that you will develop many, many wonderful associates. in the process that you're going to be in. So that's what I think is going to happen with you and for you.
Well, thank you. I'm excited about the same.
Yeah, well, me too, and I'll be around to see that. So,
Yeah.
hey, I'm just going to say goodbye. Thank you so much for the interview,
Thank you.
and we will talk later. Okay.
Okay, sounds good.
Okay. Bye bye.
Okay, bye.